Exogenous erythropoietin. So when would we use this? So we talked about one of the causes of anemia being chronic kidney disease. So if these kidneys are scarred up as you progress into the later stages of CKD, you get less erythropoietin release and less signal to the red bone marrow to make red blood cells. So how do we treat that type of anemia? Erythropoietin, right? Exogenous mean it's not endogenous, which is from your own body, it's from an external source, like a medication. Now here's the problem. Because this increases red blood cells, well, athletes like to use it because it's going to increase your red blood cell count, increase your hemoglobin, increase your hematocrit. You got more of this stuff, more hemoglobin, you have more oxygen carrying capacity in the blood, which can improve your endurance. Well, that being said, there's one issue with that. As red blood cells increase, when you get to a certain point, your blood becomes more viscous, which is a fancy word for saying your blood becomes thicker and thicker, and then it can actually slow down in your vessels, causing blood stasis, and that's one of the risk factors for increased blood clotting. So you can develop an abnormal blood clot and get something which is really scary, like a stroke. So when is this really scary? What numbers do you really have to worry about? Well, really, that's when your hemoglobin gets upwards of 20. That's when there's different things that people say or believe, but when it gets to 20, that's like, okay, that's danger zone. And here's a quick little rule. If your hemoglobin is 20, if you multiply it by 3, that should give you your hematocrit. So your hematocrit should be around 60%, right? That's kind of a general rule. That depends on hydration. If you're dehydrated, your hematocrit will go up, okay? So if you're about hemoglobin of 20, hematocrit of 60, that's very high, and you probably need something done. Okay, so obviously exogenous erythropoietin is a very dangerous drug, but it is used as a performance enhancer.